Welcome to InfoT. Today we explore the Wilbarger deep pressure and proprioceptive technique and the oral tactile technique, commonly called as the famous Wilbarger protocol. The protocol was created by Patricia Wilbarger, an occupational therapist and clinical psychologist with specialization in sensory defensiveness. The Wilbarger protocol is a therapeutic approach that consists of 4 parts: brushing, joint compression, sensory diet, and oral stimulation. It was created for children and adults with sensory defensiveness and sensory modulation problems. It is often used for clients with tactile and proprioceptive defensiveness. According to the protocol, after its application, clients will increase their brain and body self-regulation, decrease their tactile defensiveness, and have optimal arousal and activity levels. Only trained professionals by official Wilbarger workshops can deliver the protocol. Other professionals can also perform it under the guidance of a professionally trained therapist. Clients are also trained by professionals for use on their children or themselves. Now, let's briefly review the 4 parts of the protocol. The first part includes the brushing procedure. Now, it's not just brushing. A specific brush is required, called the TheraPressure brush. Then, the trained therapist applies even, deep pressure over the client's arms and hands, back, feet, and toes. It is clearly stated that you should never brush over the head, stomach, chest, and genitalia. After the brushing comes the joint compressions. The trained therapist performs 10 quick and firm compressions on the joints of the shoulders, elbows, wrists, fingers, hips, knees, and ankles. 3 compressions are performed on the sternum. The oral stimulation is only performed on clients with oral motor difficulties or sensory regulation difficulties on the mouth. The trained therapist performs oral swipes with some pressure to and around the mouth. The first 2 and the third part, when applicable, need to be administered every 90 to 120 minutes. When the client is asleep, the protocol is not administered. The suggested time frame of application is 2 to 8 weeks. They should also be administered in a quiet room without a lot of distractions. The last part is the sensory diet. Sensory diet is a set of sensory activities that are recommended by a trained occupational therapist. This part is not so strict like the others, and the recommended activities are always individualized according to the client's sensory needs. The aim is to maintain optimal arousal levels all day through. The Wilbarger protocol is quite commonly used amongst therapists trained in sensory integration. There are a lot of anecdotal reports from the therapists that the protocol really works. Unfortunately, there is weak empirical research that supports their claims. Thank you for watching InfoT. If you liked the video, feel free to like and subscribe. Stay tuned for more.